Yield the tools to make informed health choices. Today is Tuesday, August 19, 2025, and driving you through today's edition of the program are Angelina Noah and
Melvin Stewart.
And of course, we are joined by Augustine Gaiman, Communication Officer, who is here making sure that you get access to this program through the Ministry's official Facebook page. So, however way you are joining us this morning, wherever you are joining us from, we'd like to say welcome. It is always a pleasure to be here with you. For those of you joining through the Ministry's official Facebook page, we'd like to encourage you this morning to like and share the live stream. Invite a friend to watch along with you. And to our dedicated radio listeners, as I always say, increase the volume of your radio. Invite a friend or relative to listen along with you. We'd like to take a moment to send special greetings to the Minister of Health, Dr. Louis M. Porter, our able deputies, assistant ministers, and all of the staff at the Ministry of Health. We'd like to say thanks in a special way for your continual commitment to shaping the health agenda of our country. Well, this morning we have invited in studio the Neglected Tropical Diseases Unit from the Ministry of Health, represented here by Mr. Anthony K. Betty, Acting Director of the unit, and Mr. Emerson Rogers, Coordinator Case Management at the NTD's unit. Well, they are said this morning to provide valuable insights to educate and make us understand what neglected tropical diseases are and what is being done by the Ministry of Health to control and eliminate these diseases. We will take a very short break and come back.
Monkeypox virus is the newest inline it kills. Anyone can get affected by it, and anyone can have be a government official or citizen.
Welcome back and thanks for rejoining us. We're now joining our guests in studio. Beginning with Mr. Betty, good morning.
Good morning.
It's good to have you here this morning.
Thanks for that.
It's the first time, so tell us a little about yourself, who Mr. Anthony K. Betty is, and the work that you do at the Ministry of Health.
So, my name is Anthony Kepler Betty. I'm President and Acting Director for Neglected Tropical Diseases at the Ministry of Health.
Maybe louder a little bit for our listeners.
At the Ministry of Health. And I hold a master degree in public health and a master of science in global health.
Okay. Let's hear from you, Mr. Rogers.
Okay, my name is Emerson Rogers, and I serve as the National Coordinator for Case Management for Neglected Tropical Diseases and hold a Master's in Public Health.
Okay. So how is the Neglected Tropical Diseases Unit at the Ministry of Health?
So the Neglected Tropical Diseases Unit was established in 2011 to manage group of diseases at the Ministry of Health. We have a director and then the various coordinators that take care of viral entity diseases like river blindness, that's pulposocasis, lymphatic filariasis, the B4. Then we have human African trypanosomiasis. We also have a coordinator for that. We have schistosomiasis and source-related hematiasis. These are various type of worms. We also have a coordinator for that, and then the case management, neglected tropical diseases, which include the say, really also is a big soul, yogs, etc.
Okay, so Mr. Rogers, you want to add to or Mr. Betty just said?
Yes, actually the entities program is very big, as the acting director said. We have the preventive chemotherapy and we have the case management. So as he rightly elaborated, the case management are diseases, group of diseases that require case management intervention. And the neglected, the PCT, which is the preventive chemotherapy, are those conditions that we do mass drug administration for all over Liberia in the 15 counties. So the conditions that require case management are the leprosy, Brody also lymphedema, hydrocele, and yours. So these are conditions that the case management intervention is responsible for.
All right, Mr. Betty, 2011, this unit was established. What is the intent? What is the significance of this unit?
So before the unit was established, we have the River Blindness program that was established in 2000. And then coming to 2011, we started to do mapping, that is to look for other diseases. So we did mapping for the B4, which is the lymphatic filariasis. And then we also did mapping for schistosomiasis and then the various type of worms. So the ministry deemed it necessary to group these diseases based on the World Health Organization policy, because these are group of diseases that are grouped together to affect a lot of people in poor rural communities. So it's not only Liberia, but neglected tropical diseases. There are about 25 of them that have been forgotten about. It's not, they never have support, so people been have interest in them, but it's been killing people, causing a lot of problems, economic problems, social, causing disability to human, and then make them lose their life. So they are a group of diseases that we manage, but they are causing a lot of disabilities among the population.
Let's.
For blindness,
Okay.
the B4 sometimes.
Is that the one we normally refer to as elephantiasis?
Yes, elephantiasis, that's the lymphatic filariasis. So these diseases, we provide free medication for the populations in the community. So we train the community people, and then the drug is being provided free of charge from the World Health Organization. So we train the community people to distribute the medicine on themselves in collaboration with the county health team and also people at the health facility level in those communities.
Let's take it bit by bit. This elephantiasis or this Bigfoot, how does it come about? How?
So it's a condition that is caused by the bite of an infected mosquito. The same mosquito that causes malaria, the Anopheles mosquito, is the one that transmits the disease, the human. So when it is being transmitted into the human body, it affects the blood vessels. When these blood vessels are affected, most in the lower part of your body, these vessels become constricted and then they will not receive oxygen. As a result, what happens is your foot, the tissues start to grow, and then if people develop it, if you see it, you live with it until you die. So what we're trying to do is to interrupt the transmission so people can get the disease. So that's why we give the medicine on a large scale. Why we give the medicine in the community is that if we put this medicine in the clinic or hospital, you will not have a lot of people taking it. People want to go to hospital or health facility here when they are sick. If you're not sick, definitely you go to hospital. But the disease lives with the people in the community and it's affecting them. So a study was done that the community could do better in distributing the medicine than we put in the clinic. So that's why we train the community to give the medicine to the population. Not only for the B4, but also for river blindness, which is onchocerciasis. So we give ivermectin or metisan is a tablet, and then along with another one medicine called albendazole, we combine them to give them to the community people to distribute to the population.
So what about the river blindness? What causes it?
So the river blindness is caused by the black fly, and then you can find these black fly in the river that's floating very fast or quick. So that's the breeding site. So the fly live there and then they are infected. So when people go fishing, you go bathing, you get bathing with the fly and then you get infected.
So like Neville said, we should take it step by step. So you talked about elephantiasis, the Bigfoot, and then we talked about the onchocerciasis, we're touching them one after the other. So, and we are talking about neglected tropical diseases. That means there are many. So, can you just tell us what are the different types of neglected tropical diseases, and which one of them we can say common in our setting?
So we have about 25 of these diseases, and out of that 25, we have 12 that are prevalent in Liberia.
Okay.
So out of that 12, we also divided them into two. We had the preventive chemotherapy diseases, as river blindness, the B4, elephantiasis, the source permitted elephantiasis, the viral worms. You have a whole worm, round worms, all these different type of worms. And then we got schistosomiasis. It's also a disease where when people are affected, you pee the bottom one count with blood more especially. You can find this it's in 13 of the 15 counties, with the exception of Grand Coup and Riverside County. But the most prevalent counties are Bond, Lofa, Nimba, and Maryland County, where the prevalence is about 50%.
You say for the ones who
that-
have prevalence within Liberia.
So that's for system, and then for the B4, we also have it in 13 counties, with the exception of Bonny and Bapum. But in that, with the B4, we are actually doing well. So we started giving the medicine in 2012. We have actually interrupted with transmission. So we have stopped giving medicine in about 9 counties. So only 4 counties now remaining. We are doing another test, maybe 2 will pass. Then we'll be having 11 counties, with the exception of Bapum, Bonny, Grand Cru, and Maryland that still have cases. So the rest of the county, we're going to start giving medicine.
Okay.
And then for river blindness, it's in the 15 counties. So we've been giving medicine since 2000. From 2000 up to present, the prevalence was around 18%, but presently we are at 6%. And then we're going to do another evaluation to see the level we are. So we do both. So we got epidemiological evaluation. We take the blood of the human being and check to see whether the disease is in it. We also collect flies, the black flies, to also test the fly to see whether the fly are still infected with the disease. So that's exactly what we are doing.
How do you collect the flies?
So we have a method to collect the fly. So where the river is floating very fast, we get people from the community, and then they go. We give a spray. They spray on their foot, and then sit. When the fly sit on, then they collect it, and then we dissect those flies and take it to the lab to see whether they have the disease in it. So, and then we have been doing that with support from the Center for Neglected Tropical Diseases, and then AfriNet. So, by 2030 we should be able to eliminate at least one of these diseases in Liberia, more especially the fatty filariasis.
Fatty filariasis, the default.
Yes.
Okay.
But let me come in quickly before we go to Mr. Rogers. This big foot, I can remember when I was growing up in the interior. I mean, the village, and we saw a lot of old people with this big foot. But most of the times, people blame them on witchcraft activities and all sort of traditional practices.
Yes, they call it Gua.
So it's not actually due to witchcraft. Where you have a lot of mosquitoes infected with the disease, people get infected, and then you have the disease. It lives with you from the beginning, maybe when you are over 5 years old, but it will not show any sign in you until you become very big, maybe in an adulthood, from 20 years old up. So, but the day you see it, it's not going to change, and they have 2 complications. You have one called it make the bear big, as we see. So when that foot big, it's very firm. It's not like the Gua you're talking about. Painful.
It becomes black.
Yes, very painful.
Mr. Rogers,
Yeah.
you want to add up to what the acting director said? I know.
Yeah, sure. So, firstly, I will begin with the lymphatic filariasis. To identify or look for these cases, they do house-to-house search. We call it active case search. So, when these conditions or these patients are found, they are referred to the health facility where they are confirmed that they have elephantiasis, and then we provide them with what we call home-based self-care kits. So the home-based self-care kit is like teaching the person how to take care of their leg, the affected leg. All right, and actually when you see these conditions in the villages also, the legs are very, very big, and the patient don't really know how to manage their leg. They look very dirty. So we teach them how to take care of their leg and keep it clean, and teach them various exercises to do. And within the kit that we provide for them, it has antifungal cream or antibacterial soap, bandage, and what so forth. So they are taught on how to use these things, because the more you use them, it helps for the leg to reduce to some level, but you are not going to regain your normal leg. So that's why we say you live with it for life. And since we don't want majority of the population being affected, we do the mass drug administration. Through that process, most of the microfilary worms, those are tiny worms, are killed. So it is the adult worms now that cause the damage in the lymphatic system that results into fluid going into other body parts, like gallop business going into, and then you find the body parts getting swollen up and swollen up. It's the same, you find fluid going into the scrotum of the male, and the fluid shouldn't be there. And then you have the scrotum getting swollen, and that also is called hydrocele. These are the two conditions that the complications of lymphatic filariasis. And let me just give you a statistics of recent, just from 2024, 2025, we were able to clinically confirm 100 cases of lymphatic lymphedema in Liberia. That's the general country statistics. So it shows you that we do have the burden. And as he said, that we are trying our best as a program with support from partners also to see how to eliminate lymphatic filariasis, because it's targeted for elimination by 2030. And then for hydrocele, just within 1 year, just a statistics now for 2024 to 2025, we were able to confirm 243 cases of hydrocele. And out of that, through support of one of our partners called Sac Savers International, we were able to conduct hydrocele surgical campaign in 5 counties, and we were able to treat or do surgical intervention for 196 of the 243 that were confirmed by medical doctors at the hospital. So we are making some gains. Though there are a lot of challenges, but some of the conditions too that we refer to or we attend to as case management is Brody ulcer. Now this is very key. Brody ulcer, most often people refer to this as Goa, and then it's also attributed to witchcraft based on the myth. Okay, and that's what I said, that these conditions are associated with stigma and discrimination. Brody ulcer is caused by a bacteria. All right, and how people get it is that they swam or water that are moving very slow. All right, it's where the bug that causes infection, that's the environment. So when you get exposed to the environment that has the bug, you will get bitten by the bug, and then you get infected. All right, and when you get infected, what makes it more peculiar is that the condition is not painful at the onset. It has stages it progresses to, and then it starts like a knot, referred to as nodule, and then it progresses to another stage, and when it gets to the edematous stage, that is the swelling, it's still not painful, and then out of a sudden it just bursts into a very big wound. Like if the patient swelling just opened up like today or yesterday and went to the health facility and the clinician asks them, how long you been having this wound or this ulcer? They tell you it just started yesterday. You wouldn't believe it, because the progression is not noticed, because it's not associated with pain. People will say that just something normal that is happening to them, it's not painful, but actually the bacteria is eating up the fat that is under the skin and just leaving the surface, the skin itself looking normal. And then out of a sudden it gets ruptured. Then you have a very huge wound. And if that wound is not treated with the right kind of antibiotics, you can go with that wound for as long as 5-6 years. And because of that, people will say you are in witch. You know, those who are not, our people that are not educated to that, they will tell you that, look, you are in witch, or there's a witchcraft.
Because you're so can kill.
Yeah, because the soul can get killed. And even because of the myth, people were associated that in the night, you know,
They were they beat their pepper in there.
Exactly.
That's their butter.
But it's very serious, because it also has economic impact, negative economic impact, because of the stigma associated with it. You are working and someone tells you, you see yourself just have the huge ulcer. Definitely you won't be fine getting a brighter frame. And even if you are someone who earns and is working, you wouldn't want to go to work, so you have to sit home. So these are things that we actually are responding to. Though I said that they are free of challenges, but I think we are doing our best. One of the gains we've made, especially for Burudi also, through the help of our partners in WHO, we're able to strengthen the National Reference Laboratory to do the confirmatory test. And the lab has been capacitated to the extent where we are receiving our results every 2 weeks. So if a patient is suspected in Maryland and the sample is collected and sent to the National Reference Laboratory, that patient is placed on wound care until the results return. And then if the results is positive, that patient is placed on the right kind of antibiotics. And within the course of 56 days, because that's the course regimen for taking the drug, the bacteria is killed. But then the wound still remains. You have to continue wound care. And if the wound is still huge, we have to do skin grafting to speed up the healing processes.
What do you mean by skin grafting?
Skin graft is a surgical procedure wherein you have to take portion of the skin from another part of the patient body to cover the wound. It helps in healing the wound very fast.
Okay. Yeah, so I want us to talk a little bit about the symptoms. I mean, we target all of the diseases we have touched when it comes to the symptoms, because people have to look out for it, to be able to detect it at the early stage. But it's Betty, do you have anything to add to what he said before we move to the symptoms?
Yes, I think he said it all concerning the case management cases.
Okay.
When it comes to river blindness, as I said, we get it from the Fast Flowing River, where the black fly, the breeding site is the river. And then for schistosomiasis, it's the snails. It's not the snail that we eat, very small snail that are in the creek. So there they live and and survive. But when people who doing farm work, children who bathe in water, when they get in the water they get infected with the snail. So the one leave the snail and penetrate their skin, and then affect the bladder and then the intestine. So in Liberia we got two types of those kind of disease. We got one we call Schistosoma hematopia, they affect the bladder, where the people who are affected urinate blood. And then the Schistosoma mansoni also affect the intestine. So when you go to defecate, you see blood on the stool. So not all the blood you see on the stool is the diarrhea. So people will say, oh, that dysentery. So if you toilet and then you see blood on your stool, so it's a be of concern to you to make sure you check the hospital to see what is happening to you.
That's for the
System.
Okay.
And then for the other one, the various type of ones, the whole one, the raw ones, the eggs, when we eating fruit or vegetable, you just grab the fruit and eat. You swallow the eggs of the worms, and they also affect you. They affect a lot of the children. Sometimes they go to school, they just sit down, they don't honor, they don't think properly. So some of them have a big stomach, and then they also make their blood to get dry, anemia, and then leads to diarrhea also.
I didn't hear about yours. Is it YWS? What is it?
Okay. Yours is a bacterial infection also. It's a condition that is communicable. When we talk about communicable or communicability, is that it has the potential to spread. Okay, it presents like an outbreak, and it's caused by a bacteria that is called Treponema pallidum, and Pertinium. So once one person gets infected, it's possible that an entire community can get infected from that one person. So we don't take it lightly. And
How does it treat somebody?
all right, the first presentation, we call it clinical presentation, it comes about, you will find that the person will present with yellow bumps. And the yellow bumps is the characteristic of identifying or differentiating that this is yours from other bumps that may appear. And the bumps may appear either at the corners of the mouth or any part of the body. That's the first stage, that's the first symptom. If it is not diagnosed at that stage and treated, it progresses to what is called ulcer. But the ulcer is not like Buruli ulcer. For yours, ulcer is painful. It's very painful. And if the condition is not also treated, it can lead to disability. It affects the long bones, the fingers, the legs, and that can also lead to disability. And the treatment for that is azithromycin, which is very effective. Single dose of azithromycin. Now, just to give you a little history, we had yours in Liberia in the 60s, in the 50s, and then it got eradicated, all right, in the late 60s, late 70s. But of recent, we started having re-emergence of the disease. And to be specific, in the Southeast, we've had yours cases being reported from Maryland, from Sino County, from River G, from Grand Cru, from Grand Gide. So just to give you statistics that we have just from 2024 to 2025, we were able to confirm 190 cases of yours. And
In the 4 counties?
yes, all right, and mostly from River G. So River G alone, we confirmed more cases, and because of that, we have to treat almost an entire community that has a population of 101 inhabitants. So we were able to administer the azithromycin to like 82 persons in that community, and we want to be very thankful to the River G County Health Team. They were very proactive, and when the condition was observed among the population, they moved in right away and administered the mass community administration, okay, of the azithromycin to the affected community. So we don't take yours lightly. In as much as it's communicable, it's something that we have to stop interruption. So we plan to do mass community administration in 4 counties, but because of funding constraint, this year we will not be doing it in 2 counties, and that's Sino and River G, because of the burdens of reports that we are getting from these 2 counties. We will be treating those communities that are affected. We should be treating the entire county, but mainly the hotspots for those communities are the ones that the population will be treating for this year. So we do have re-emergence of yours in Liberia, and Enfield, the National Public Health Institute, is already aware of that. And we are being supported by WHO and our partners. We do have the test kits currently in country, and also they have supported us with the azithromycin, where when we're ready.
Is it a vaccine or what?
The azithromycin is a tablet.
Or tablet?
Yes. Before then, it was being treated with benzathine and doxycycline. But benzathine is an injection. It's part of the penicillin injection family, but it's very painful. So you wouldn't have patients complying, where the patient have to take about 6 different doses of benzathine. And doxycycline also has a very bad side effects. So WHO has recommended the drug of choice for treating yours to be azithromycin, and it's just a single dose, one-time tablet you take, and then they kill the bacteria, and you find the patient improving.
Mr. Director, let's talk about leprosy. It's one area because what is leprosy and how does it come about?
So leprosy is a condition that is caused by bacteria too, microlepra. So they affect the nerve. So in Liberia, before leprosy been in this country for a long time, even when we came and we met it. So you should have a lot of colonies in Europe, area where they used to, anybody affected with leprosy, they'll put you in a camp. You remain there. They have some in Zozo, Bonica in Maryland, Masati. But this time we don't put people actually in a colony. So with the help of the World Health Organization, we have a multi-drug therapy. So people who are affected with leprosy, when they are tested, we put them on a medicine. Some are 1 year, 6 months, and the other one is 1 year treatment. So when you complete that, they heal, but then sometimes they have disability. So depending on the part of your body that is affected, some will heal, but then the disability will remain. Some that maybe affect the eyes, some they affect the hands. You see their hands short of the toes or under the sole of the feet. So we are also doing testing for that in Liberia at the reference lab. So they have cases, more especially in hard to reach area. They having new cases of leprosy. Last month we did a campaign in Bapuru County where we went in Bella Forest and other part of Bapuru, and then we were able to identify cases, and then those cases were sent to the reference lab, and we were able to place it on treatment.
So let me just add up. As you rightly said, leprosy is caused by bacteria, and it's also a condition that has the potential to spread. It's communicable. Yes.
You sure?
It is communicable.
How? Because you're getting me afraid. Because
don't be afraid.
The last time I was in Swakoko in the rehabilitation center, the Swakoko leprosy rehabilitation in Bon County, and I spoke with some of the lepers, and including some of their grandchildren. And I was interacting with them.
So yeah, great. Leprosy, I would say that scientifically it's believed that it's gotten, from an infected person who has the disease, and when that person cough, or sneeze, and you happen to inhale, because as a cough or sneeze, they pull out millions of bacteria in the air, and then when you happen to inhale that, droplet, and your immune system is not well equipped enough, you contact the bacteria. But the disadvantage about it is that leprosy takes several years before it manifests, before you start seeing signs and symptoms. So someone who has lived with a leper patient, a person, and that person has not been diagnosed, you can live with that person for like 20 years, 30 years before that person starts to present with signs and symptoms of leprosy. So that puts you at a disadvantaged point. So that what we say is communicable. So your long interaction with the leper patient, not because you just went there today and you interact there, you think you're going to get it though, but your long interaction with a leper patient, living together now for a very long period of time, can expose you. But what is very good about it is that the drug is very effective. All right, we call it multi-drug therapy. It's not a one drop, 3 drops combined. So if a leper patient is being confirmed today and we initiate treatment, it takes you like 1 week. The transmission is interrupted. That is, as long as you start the treatment, it starts to kill the bacteria within the person. So in 1 week, it neutralizes the bacteria. and that person cannot spread it to any other person again. But it's just that the duration of the treatment goes for a longer, a longer period of time. Like we have two kinds of leprosy. We have the multibacillary and the paucibacillary. So the paucibacillary treatment goes for like 9 months. So you have to take and complete the treatment before you have relapse. And for the multibacillary are the group of people that can spread the disease because the bacterial load in them is very high, and that treatment goes for 12 months. All right. Also now 12 to 18 months, and you must complete. If you don't complete your treatment, definitely you wouldn't be healed or cured of the bacteria. You need to complete, in as much as you are not transmitting, but the bacteria stays in you. So you have to complete. And as the acting director rightly said, that leprosy leaves you with disability if it is not diagnosed early. So that's why we said that we're working with the community health structure of the Ministry of Health that have the community health workers in the rural communities that are looking for these conditions, and as they find them, they refer them to the health facilities where they are clinically assessed and then diagnosed, and then immediately placed on treatment.
Okay.
Yeah.
Well, this leprosy, like you said, is something that can spread. So how can we prevent it? How can we prevent this? Do we have any preventive measures or methods?
There are preventive measures, but it's a little bit complicated. Now, what makes it complicated is that, one, you wouldn't know that someone has leprosy if the person has not started presenting with signs and symptoms, and if the person has not been diagnosed and placed on treatment. So, the preventive measures that you have to avoid prolonged contact with a leper patient.
It's difficult, like you said.
That's why I say it's complicated. So the best thing we can do is strengthen our surveillance system, and then do more community active case search, whereby we'll be able to identify the cases early and place them on treatment. And just for statistics, for 2024 to 2025, we're able to confirm 83 cases of leprosy, and we place them on treatment. And out of the 83, there were 15 children. So that shows that there is active transmission ongoing. So we are not taking it lightly. We are doing everything possible to ensure that cases are being, when they are diagnosed, contact tracing is being done, and cases are being diagnosed as early as possible. We do have cases that are diagnosed at the stage of even presenting with disability. And when you present with disability, it's irreversible. So we just have to place you on treatment, you complete the treatment, but the disability remains. This is what makes the condition stigmatizing and discriminatory. But that's it.
Mr. Betty,
Yes.
you want to add it?
Yes, so I'll be going to river blindness and other
Yeah.
entity diseases. So for the river blindness, from 2021 up to 2024, we deliver almost 11 million treatment to the population. So in 2021, we treated about 3.1 million people with ivermectin and albendazole in the community. And in 2023, also treated 2.6 million. For the big foot, we also treated 3 million people in 2021, 2.5 million in 2022, 2.7 million in 2023, and 2.1 million in 2024 in the 13 counties. So most of these treatment is being provided by the community. We train the community people to give the vaccine to the population, because we're giving it on a mass scale to cover a large populations that are affected with the disease. And that also goes with the schistosomiasis in the 13 counties, but the most prevalent counties, as I said, Bond, Lofa, Maryland, and Lima, we administer vaccine every year to prevent them from getting these diseases.
Okay.
So,
All right, so we'll open the phone line now, Melvin.
Yeah.
So if you just join us, you are listening to Roadway to Health, an hour-long program brought to you by the Ministry of Health. designed to educate, inform, and empower Liberians about health-related matters. This morning we are in studio with Mr. Anthony K. Betty, Acting Director for Neglected Tropical Diseases Unit at the Ministry of Health. He's here with Mr. Emerson Rogers, Coordinator, Case Management at the Neglected Tropical Diseases Unit. They are here this morning providing valuable insights to the public on neglected tropical diseases and what is being done by the Ministry of Health to control and eliminate these diseases. To call and be a part of this conversation this morning, you can call us on 0880 514 0880 514 or 0775 677 376. 0880 514 At the number is the Lone Star number, and 0775 677 376. Call this morning, be a part of this conversation. You can make reports, you can ask questions. I mean, looking out for the symptoms, how you can detect this earlier. We have our health expert this morning said.
Good morning.
Presentation this morning. I want to find out something like the diseases you just mentioned this morning. I explained well about them. For me, I have been here for 8 years, but in Ghana, but I have not seen the distribution of those medications you are talking about, like medicine and others. So how can I be able to reach and get this medication for prevention purpose? And the second question is there a vaccine to those diseases?
Okay, thank you so much. They are jotting down the points and they will address your concerns. 0880514096. Morning.
Yeah, good morning, by the way.
It's not family, please. Melvin, go ahead.
I'm sorry. Well, I'm here and I'm calling from Jamaica Road.
Go ahead.
Yeah, my question is the way they were saying about the people. Sometimes when a cook get beef, you see the beef so there. It doesn't mean that we can declare our family. But let me say the hospital, they will say if you want to do the injection, it will increase. So you have to look for the country or medicine to apply it before you can come. Can you imagine these 2 days, my family, they full beef. But now it can't, the soda there, the soda can be cured almost more now. That's my concern.
Morning.
Yeah, good morning.
Please go ahead quickly.
My name is Walter Blooming, and I will show you for Station Number 6 in Capital, in my county. Well, let me firstly applaud your video guest because telling about radio and America education this morning regards to the kind of situation. Because many people refer to those kind of conditions that they were just explaining about. They can't repeat to witchcraft and all kind of stuff. But to just brighten our minds to this morning, I just want to say thank you. But my recommendation and concern also be about we are not actually seeing it because it's all about coordinator in the rural county or the district. We are not seeing it around our district, whether they are attached to some or cleaning other things in the local settings, but we are not fully informed about it. But thank you all so much for coming to the radio to let us know about it. Thank you.
Morning. Good morning. Good morning. Go ahead. Go ahead now.
Yeah, I have a problem, from my waist down, so now my leg in the delta, the whole place can be heavy. Only them I feel pain in my foot. So then I started listening to the radio, I heard you talking about, to be prescribing or medication for it. So I want you to help me in the process. I really want to know,
All right, just keep listening. They will soon address the concerns. I want us to take a few calls, then they will address the concerns, then we'll let them go. Let's hear from here. Morning.
Good morning, sir.
Good morning.
Yeah, I listened to the two guests.
What's your name, Chief?
But I'm I'm from Nimba, but right now I'm from Broken Bay, Greenland.
Go quickly.
Yeah, so they are completely divided at mechanism. And now they can't do it every month, but people bring them to they brought to us and they told the king are going to help us. But the question I want to ask is that after they did the experiment on the plant, what were some of the results you put down with? Thank you.
Morning. Good morning.
Good morning, sir. Good morning.
Please go ahead, Chief. No time.
Isaac Mohammed Mosale, I call from Subaton. I'm so glad for this program. I say bravo to Minister of Health. I'm concerned about the treatment that you mentioned, arithmetics. You see, I didn't get it clear. What causes for that treatment to be applied to people?
All right. Thank you. We'll take two more persons quickly and go back to our guest, Angel. Yes. Maybe we'll take two more persons quickly. Morning.
Morning, and good morning to your speaker guest.
Please go ahead. Please go ahead.
Hey, my name is Frank. I'm calling from Bureau. I want to thank you for you called me elaborating this morning about especially when it comes to the elephantiasis. Most times, our days when we used to see people with elephantiasis, just hold the name, follow another name's where the disease was true only. But today we got to know that it's some certain diseases that are inexplicable and so forth. So thank you for this educative program. I hope you guys will always come to it on the laboratory room so we hear what needs to take precautions according to the statement. Thank you so much.
Thank you. Let's take the last person. Morning. Good morning.
Good morning.
Good morning.
Morning.
Please lower your radio. Please lower your radio.
Ronnie and Harris were from Peaceville.
Please go ahead.
Yeah, so I'm going to have to do it. This everything I'm saying that is a communicable disease. Well, the last time I listened to another station, they were discussing everything everything. They are talking, I think somewhere around Nimba County, and they have a health practitioner that was there. Also, they interact with the people, eat with them, and do other things. But now I'm hearing this morning that it's communicable. So I don't really know if it is real communicable or non-communicable disease.
Thank you. No more. No time now for calls.
Yeah,
So we just hear from our guest, Aisha.
So thank you very much. I will start with the first quarter from Banga. We have neglected tropical diseases focal protein in all the rural counties, and then the treatment in Banga, but the treatment is once a year. So from November to December, we administer the treatment in all over the county and the rest of the country. So it's not that every month we give it, or it's only one time in the year. And then if you take it, it will last in your body until the following time, the same time again we give it. So we give it every year. We have people in the counties working with the county health and the community that distribute the drug, the vaccine. Somebody asked for vaccine. We don't have a vaccine for the diseases, but we have tablets that we give to people on a large scale. So for the viral diseases, we have different tablets that we give, depending on the sickness. Like for river blindness, we give the metizan. The B4 we give albendazole, and then for the one people with blood, we give praziquantel, and then we also give albendazole for the worms. And if you go to leprosy, we also have different medicine as you talk about, and the breeding also have different tablets, but we don't give vaccine. Then the third call was from Mike DB, where he talked about he are not seeing the people that distribute or the coordinator. So we have a focal point in the county that work with the county health team, and they work with the rural health facilities. So at the health facility level, we work with the community health services supervisor. At the district level, we have the district social officers, and then the community level, we work with the community health assistant, and we also have the community health, community drug distributor. They are in the community to assist in distributing the drugs. So these people are all around, but then it's only one time a year. And then the fourth caller talked about pain in his waist. He cannot walk from Banga. So the advice I will give you is to go to the nearest hospital so you can check, and then you will know exactly what will happen. What happening to you? The doctor will advise you. If it is any of the condition that we are talking about, you can contact the county health team, and they will get to or will be able to help you.
Okay, Mr. Betty. Yeah. So we are out of time. So I want you to give.
One more. There was a guy who called from Johnsonville. So the test we did was the pre-test for the Bigfoot. So we collected blood from people and tested it, and all were negative. That's the reason why we stopped giving treatment for Bigfoot in Monserrado. As I said earlier, we have stopped giving treatment in 9 of the counties, with the exception of Kidmount, Maryland, Grand Crew, and Sino. And then Bapolu and Bombing that do not have before.
So maybe 30 seconds because we are out of time. Your party comments, and we'll go to Mr. Rogers quickly.
So I just want to give thanks to our partner for the great support. Site Saver, Ife Hope, Anisvar, Home Rises, German Leprosy and Relief Association, the Cali Health Secretariat. We also have Liverpool School of Tropical Medicine or Lime Health. We have all these partners, Afinet, the CDC. They are our supporter, buttressing the effort of the Ministry of Health to make sure that we address these conditions in the rural community for our people to be healthy.
Thank you. So, Mr. Rogers, we are out of time. Your party comments.
Now, my party comment would be that we encourage our people whenever they see anything abnormal on their skin, whether they are presenting with fever or not, please take advantage, make sure to visit the health facility so that you will be diagnosed early, because we said that these things are associated with stigma and discrimination and also render our people disabled. It cripples you for life. So that's my advice, and that's my party comment.
Thank you so much.
Okay, so whenever you see anything abnormal on your body or any parts of your body, please make sure to visit the nearest hospital. With that, this is how I would like to leave you on today's edition of Roadway to Health. Many thanks to our guests, Mr. Betty and Mr. Rogers, for providing such valuable insights to the public this morning. We have been your host, Angeli Noah, and
Melvin Stewart.
And Augustine Gaima has been here streaming live. Until next Tuesday, have a good day.